So RSV is very common today, and you might see some things in your child that can easily be managed at home. A couple of things that might occur would be a fever, which you can treat with antipyretics such as Tylenol or Motrin. Another would be suctioning. So the children may have boogers, they might be congested, and you can suction at home as well. Keeping them hydrated is very important. There are some observational symptoms, though, that kind of graduate us from the mild to moderate category in terms of how severely or how much they're struggling to breathe. One of those would be how fast they're breathing. So these children will start to increase their respiratory rate as they're struggling to breathe. Oftentimes an increased respiratory rate will follow with a fever, though. In addition to this increased respiratory rate, you might start to see some what we call retractions, and that is the use of the rib muscles here working a little bit harder so that the child can breathe a little bit easier. And then lastly, you might start to see what we call belly breathing. So that belly breathing is going to be observed right here, where they start to really work that belly to compensate for how much they're struggling to breathe. All of these are potential symptoms that might appear with RSV, and it's important to know the baseline of your child so that you can know when you need to call your doctor or medical provider to seek help. So if you start to see any of these symptoms progressed where your child is really struggling to breathe, that would be the opportunity to reach out to your primary care physician, your pediatrician, or maybe even schedule a virtual visit so they can see your child and evaluate and determine the next best steps. If you do happen to see any sort of symptom that involves blue discoloration around the lips, or maybe starting to look a little bit gray and becoming a lot more lethargic than normal, all of those would be considered a medical emergency and you should seek care appropriately.